record. All right, welcome everyone. Thank you for being here for the IOPTP webinar titled Specialization, the What, Why, and How, being led by Donna Cech.
Check.
Yes, and Barbara Connolly and Yasser Salem. They will be leading this lecture today, as well as a panel of international members. And I wanted to give your attention over to the QR code on the screen right now, that and the link down below. If you want a certificate of attendance for continuing ed purposes, please go ahead and complete that form right now. We'll also bring it up at the end of the webinar as well to give you an extra chance. But if you're on right now, I would encourage you to complete that so that you will receive, only those that complete that form will receive a certificate of attendance. I'm Carissa Wingrovius. I'll be your moderator today. So feel free to send me a chat in the chat box if you're having any technical issues. Also, the speakers have said that they will go ahead and stop periodically throughout the webinar to answer any questions. So go ahead and throw your questions into the chat box when you have them, and we'll address them periodically throughout the webinar. And I think we will get started. Yasser, if you don't mind going to the next slide. Yep, so panelists representing member countries with a specialization process. And so Barb, Donna, and Yasser are from the United States. Ingun, it's Skogsteth Stevens is from Norway, and Misako Yokoyama is from Japan, who will be part of the panel today. And I will let Yasser kick it off from here. Thank you.
And actually, these are our panelists. Yasser, if you go back to the next one, we have three panelists. You just heard their names for people who have specialization. And we're really happy to hear and what is going on in Israel, Taiwan, and Indonesia, as these are countries that are developing specialization. So Darrell Shapiro, Li Chao Chen, and Johannes Perwanto. Thank you for joining us, and we'll meet you later.
Thank you.
Okay, Yasser, go on ahead. So at this point, Barbara is going to take over, and I just want to welcome everyone. My name is Donna Cech. I'm the chair of the Education Committee. And many of the panelists and some of you possibly in the audience have filled out our two surveys in the past year. We appreciate the input. And the Education Committee does really try to keep track of both entry-level education and trends across the globe and be there for support for countries. And this year, in addition to on our one survey, based on requests from the executive committee, we put in a question about the length of the webinar. So our feedback was that respondents to our surveys really felt that longer webinars were more valuable, and I'm glad to see we can get a continuing ed certificate at this point. And so this is our first attempt at a longer 3-hour webinar, and we'll be anxious to hear your feedback and see as attendees what you thought about it and what you feel about the time frame. We may or may not use the whole 3 hours. It really depends on how you as attendees want to use this as a ground for asking questions and as a sort of a way to get some input for your countries. So with that, I'll turn it over to Barbara, and she can begin to tell you about how our surveys came about and where this need for a webinar on specialization for pediatric physiotherapists came from. So Barbara, I'll take it to you.
Thank you, Donna. It's glad to see all of you on the webinar today. I'm I'll give you a little bit of history. When the IOPTP started in 2007, and I don't have the information from 2007 on the PowerPoint, we had an interest in specialization even in 2007 when we were incorporated in Vancouver. As our numbers have grown as IOPTP, we wanted more surveys. Let's see. Let me see if we can get that PowerPoint back on.
Donna, I think
Yes.
you started
What?
sharing your
Okay.
screen, if you don't
All right.
mind
I'm trying to
unsharing.
get off.
There you
There
Okay.
go.
we go. There we go. So after the 2007 survey, when we were looking at what the interests of our members were, we followed that up by numerous surveys. But in 2016, we did a survey about entry-level essential content in pediatrics and the physiotherapy programs. We did that in 2016 as we were being asked about specialization. Even at that point, we had a conference that was held in Singapore, and there were questions that there were a number of therapists wanting to move to Singapore and said that they were specialists in pediatrics. And the Singapore physiotherapy looked at the people that were saying that they were specialists, and in their eyes, they did not even have entry-level pediatric content. So we really realized that there was a lot of differences of opinions across the world in terms of what was entry level and what was specialist or advanced knowledge. So in the 2016 survey, which was basically focused on what is the entry-level degree, what is the content, what is the essential content, we also asked the question about specialization at that point. And you can see we had 20 of our 24 IOPTP members at that point, that 8 had a formal process for specialization, 11 had no formal process, and 1 was working. So they also said at that point that five of them reported that the Physiotherapy Association in their country was responsible for the approval and registration of specialists. So based on that survey, there were a couple of other comments that were made, and one was that we should, as an organization, have more information about what is specialization. They also certainly were asking what is entry level or core competencies that should be taught in entry level curriculum. So in the 2016 survey, again, we talked about specialization. So next slide, Yasser, please. Also in 2023 at our Dubai networking session, we had roundtables, and at that meeting, we had 15 of our 30 member organizations. And I have to say now we are at 35 member organizations. We are growing. And certainly our member organizations have different needs. Again, a major focus was on specialization, and kind of piggybacking on what we saw in 2016, we began to look more in depth about specialization. Out of that, during that period of time, many of you may have seen our documents on essential content in pediatric content in physiotherapy programs. The IOPTP has a policy statement on that. You can get it on our website if you haven't had a chance to look at that. But now, since we have identified entry level is a time when we can really begin to look at what's the difference between entry level pediatric knowledge and what is more advanced level, or the differences that are needed in terms of knowledge base for those that want to become specialists. In the 2024 member organization that was just sent out by the IOPTP, asking our member organizations about what are their needs, again, specialization came up again. So in 2024, another survey was sent out, and I'm going to let Yasser talk about that, that gave us specific information about specialization in our member organizations. So Yasser, I will turn it over to you.
Thank you. Hello, everyone. Again, it's glad to see all of you, and thank you, Barbara and Donna, for giving me the opportunity to present with you. So based on that, we thought that it's time to develop a survey to learn about specialization or advanced certification for pediatric physiotherapy practice. So we run our survey. The purpose of that survey was to learn about requirements to practice physical therapy in member organization. So we taken this information we thought that this information will help us in our strategic plan, also to help to identify how people are practicing pediatric physical therapy, if there is advanced training required, if there's advanced or any requirements for practicing pediatric physical therapy. So the survey was developed by the IOPTP Education Committee co-chairs, that was Donna and myself, in collaboration with Barbara as the treasurer of the IOPTP. We developed the survey. We ran it in the month of April to May 2024. We distributed to member organization in May 2024, and the survey was closed in July of 2024. Based on the result of the survey, we have 22 of the 35 member organizations who received the survey completed the survey. That's 63%. We have respondents from 4 of the 5 WPT member regions, and we believe, given the response rate of 63, we have 4 of the 5 regions representations. We believe that this survey is really representative of the IOPTP member organizations. So we asked a few questions to learn about practice of physiotherapy in the member organization. So one of the questions that we asked is about entry level for physiotherapists in the member organization. As you might see, 77% were actually requiring bachelor degree. Then others require other degrees, including doctoral degree. Also, there are few countries here, as you might see at the top, that go in and require just they can practice pediatric or practice physiotherapy with only diploma without having a bachelor degree. We also looked if there is additional training to practice physiotherapy, and 22 or 23% said yes, there are requirements to practice pediatric physical therapy more than just entry-level education. We asked them about what are those additional requirements or training, and they came for additional coursework. There is additional training. There is also mentorship. Those were 3, and if you count this, we talk about 11 countries that identified that there is additional training and what are the additional training required to practice pediatric physiotherapy. We asked another question if pediatric contents are included in the member organization entry-level education. As you might see, 77% said yes, and others kind of either between no or between just. It depends on the universities that you might see here. Most of universities cover 1 day of pediatric education, and some say some universities cover it and some don't cover it. But in essence, only 77% covers pediatric contents fully. In terms of advanced certification, or if there is a specialization, we found that 54 or 55% of member organizations, yes, have advanced certification. Of those, we asking them if there's requirements to complete specialized or advanced certifications, and we looked at those, and there are some educational countries require additional education degree, like a post or graduate degrees. Some require examination, some require certification, some require additional training, and fewer require supervision and mentorship. We also try to learn how long is the advanced certification or specialization in those countries that have it. Then we ask them, we give them the option of breakdowns of years, and you will see that some countries are just new to the process between 1 and 5, and also some countries are having experience more than 35 years. And actually, the one that more than 35 years, there were only 2 countries that have more than 35 years. We asked the number of people who are certified and only or having a certificate and a specialized training, and we received 6 responses only. So the range from 9 to 27 to 2750. We assume that the 9 is just one of the newer countries that have the process, and we know that 2750 is United States, since United States has a longest time in specialization, that's more than 35 years. And we averaged the 6 program, we found that around 950 physiotherapists are having specialization or specialized certificates. And just mention again, for the other 6 countries that did not provide, they didn't have the information or accurate information. That's how they indicated in the survey. So what did we learn from the first survey that we run? There is need for more information about the specialization, about advanced practice. We need to learn about the benefits of specialization and advanced certification in pediatric physiotherapy. Also, we need to learn about the challenges for developing and for also having a specialization and advanced certification in pediatric physiotherapy. We need to know about resources available to develop a specialization. We need to learn about resources available for those to develop certification. And also we need to learn how IOPTP can assist those countries who are developing specialization and what resources are needed. So that prompted us to survey 2. So I hand it here to Donna.
Okay, thank you, Yasser. And you can move to the next slide. So we did decide to send out a second survey because we wanted to learn more from our member organizations about their specialization practices and how pediatrics is practiced in your countries. We thought this would help us really learn about, as Yasser said, the process you're using, the benefits, as well as the challenges you are facing in a specialization process. And we wanted to look at what is the picture of specialization related to pediatric physical therapy globally, across the globe, from all of our member countries. So Yasser, you can move on. This time, we had 22 responses from our 35 member countries. So we thank all of you. That's a great response rate. And we had representatives join us from the South American region, so that we had all 5 regions of the World Congress or World Physiotherapy represented. Again, making us feel confident that we did have a picture from our entire membership of where we are currently as pediatric physical therapists in the process of specialization. So Yasser, you can, the next one. So at this survey, 50% of the respondents, or 11 of them, said yes, they had a process. And as you see, about 10%, so just a few countries said we're in the process of developing. And we had about 40% of our respondents saying, no, at this point, we do not have specialization. And those people jumped ahead to the end of the survey. But from the other people who responded, we tried to get more details. So Yasser, the next slide, please. One of the big questions and differences across the globe is who is responsible for overseeing and developing the specialization process. The majority of countries, member countries, said that it's really your own professional organization in your country. But 23%, or three of the respondents, said that it's the governmental organization in your country who monitors and regulates the practice of physical therapy. And then we had four respondents, or 30%, say it is some other entity other than the government or their professional organization. So, Yasser, the next slide. When you look at the exam requirements, or what requirements are required for specialization, people who give an exam, the most required that responded to our specific items were a written exam, which Barbara will tell us, based on our US experience, is a lengthy and difficult process to get through to develop and maintain that exam as current and up to date. Three respondents, or 23%, required practical exams, which again has many, many challenges to consider and takes an incredible volunteer workforce, or some workforce, to go through that. And two countries responded that there's a portfolio review. These portfolios might include, like, pediatric cases that you have had, where you submit your case notes for review on their complexity and completeness. And then other countries had other types of responses that they requested. And we can give you more details to that later if you have specific questions. Okay, Yasser? So the next question was, do you require clinical experience before someone can become specialized? And the majority of people said, yes, they do. One country said, in our country, it's part of the master's education before you can register, and you have 8 hours a week in pediatrics. And about 40% of the people say, no, they do not require additional clinical experience. And this additional clinical experience, the range of things is pretty extensive. It can go from, 100 hours or less up to more than 500 hours. So, Yasser, next slide, please. And of that clinical experience, several people said they do require additional practice hours in pediatric physical therapy for specialization. And other people, said yes, practice time, and measured in months or years. And there are some countries who responded that you need to practice in multiple areas of pediatrics, meaning neurology, orthopedics, inpatient, outpatient. So you need to demonstrate and reflect that you have a broader experience base within pediatrics. Okay, Yasser. Next slide, please. And again, here are the hours requirements. 100 hours or less was, that 7.7%. And the 61% said it was not applicable because they don't do it, but more than 500 hours was the highest response rate we had. So you can see there's a very broad range of additional clinical practice hours required before you can become a specialist. Next slide, please. And in looking at the length of time, the majority of this pie chart tells you it was non-applicable, but of those who responded, many people said either 13 to 24 months or more than 24 months, with some people responding 3 to 6 months. So there's a wide variety globally as to what are the requirements you need to become credentialed as a pediatric specialist. So additional practice hours, I intimated before: outpatient, inpatient, early intervention, school-based, neonatal intensive care unit. The other, I think, some of that involved orthopedic pediatrics as well as neurologic pediatrics. So broad requirements again here. to reflect that you could practice in a variety of environments. Okay, Yasser, I'm sorry, go ahead and advance it. Now we asked, do you require mentorship? And a quarter of the countries responding said, yes, we do require mentorship before you can become a specialist. Now, this was only answered by 13 respondents, so we're talking about 4 to 5 countries have a mentorship requirement. Okay, Yasser, thank you. And again, the majority of those people said that it was really a more than 12-month mentorship experience that was required. And in the hours, it could be anywhere from more than 500 to 100 hours or less. So a broad range of hours in mentorship. In that, it could be that you're required to have a mentor for in-person observations or in-person meetings from 3 of our respondents, virtual meetings in another couple of our respondents. So, you know, a wide variety of models, and certainly the in-person is very labor intensive for both parties involved, but if you're local and you have a local mentor, that works. And virtual meetings gives you a little more breadth if you're going to have somebody who maybe has a big busy schedule or who might not live close to you. Okay, Yasser. Now, the degree requirements was very interesting. It's like, what additional degree is required for pediatric specialization? 1 country responded the diploma, 2 the bachelor's degree. The majority, 30%, said the master's degree. And we did have some people at the doctorate and at the certificate. Now, you have to understand that these degree requirements to even practice physical therapy vary a lot globally. And I'll tell you later, I was one of the first 4 people in the United States certified. And at that point, I was certified with a bachelor's degree, which was the acceptable degree for practice and allowed me to have a license for many, many years into the US. At this point, all US graduates have a doctorate degree. So it's really your entry-level requirements that help define what your degree requirement is. And I think that's something every country who's developing or thinking about specialization has to keep in mind and make sure your specialization process recognizes those people practicing in your country. Okay, Yasser, next slide. Now, this was another interesting point. Once you're identified that you have become a specialist in pediatric or pediatric physical therapy, how long is that valid? The majority of countries don't have a year limit. It's, you know, you've become certified and that is a credential you keep with you. Other countries said 5 years or less, and then a quarter of the countries said 6 to 10 years. And at either 5 years or less or 6 to 10 years, you need to go through a process to revalidate your specialization. Next slide, please. And so this is reflected in this slide. Do you require renewal? And by a slim margin, the majority of countries said yes, but 46% of those countries with specialization do not require renewal. Okay, thank you, Yasser. The requirements for renewal are very interesting. 1 country says you need to take, it's a written requirement, you make an application. More countries do a portfolio review, and I know that is the case that Yasser will talk about later here in the US, that you need to submit a portfolio of some of your client cases so that people can see how your practice reflects specialization. And then 38% of the people had other processes that other than what we had thought to ask. So Yasser, you can go on from there. And of those, next we said, okay, now we need to know, what has this done for people in your country? What are the benefits of specialization? We had 13 people respond here, and our goal, I think, and our purpose for everyone is we really want to maximize and improve the quality of patient-client care. And that was the majority, you know, most 11 out of the 13 people said that was the perceived benefit. There is also more recognition for pediatric physical therapy profession in your countries, and recognition of those clinicians with advanced pediatric knowledge. In a couple of countries, it allows you to assess clinicians from other countries who are applying for specialization in your country. And this is what Barb was referring to. If you're certified in a country and there's certain requirements that fit your educational model and your entry-level pediatric education, it's really not certain that those same qualities are going to apply in a country that may have a much different portfolio for specialization. So we need to keep that in mind. Countries need to develop what works for them and what will improve patient care in their countries and will advance the pediatric physical therapy profession within your countries, but know that it's not automatically accepted in other countries. They need to be able to see your process and evaluate it in comparison to their practice model. Thank you, Yasser. Next slide. Now, there are a lot of challenges to starting specialization, and I think we'll hear later that some of those from some of our panel members. Most respondents said that the cost is a big stumbling block because it's labor intensive to develop the process. And government regulations in some countries really limit what you can do. And some of you in your countries, your profession is regulated and the specializations you can have is regulated by your country government and licensing bureaus. Other countries replied that a challenge was the organizational structure of their professional organization in physical therapy. Is specialization identified and recognized within that structure? Or is it a new thing that the whole organization has to develop? And then within your country, how many people are interested in developing it? It's labor intensive. It takes a lot of work. And so do you have the manpower to support it? And that was certainly responded by 7 out of 13 respondents. Okay, Yasser. The resources that countries have used to develop their specialization include the WPT member organization in their country. So as pediatric special interest group, some kind of the pediatric organization that's you belong to. Government funds, 1 out of all of our respondents had government fund resources. Charitable contributions, another 1. The majority of the support and resources came from the dues assessments within your pediatric physical therapy organization, some personal contributions, and that can be labor or financial, and then other things. Okay, Yasser, next slide. Now, when we jump to question 33, this was for the people who who acknowledged early on that they did not have specialization. So they said one thing is their WPT organization does not support it. They don't have the support of their member organization. Others, 4 people said it just doesn't fit the organizational structure of physical therapy practice in our country. And, a third of the people, only 3, but a third said government regulations do not allow us to have this recognition in our country. And then the last third said lack of resources, financial and manpower. And I think you need to look at both of those as important resources. Okay, Yasser. And here they listed, if you do not have or are not planning to have it, is there anything that could help you if in the future? And funding came up with a couple of people from government. a charitable organization would be in a good resource. The dues assessment. So again, these are looking at financial issues. Then the manpower, the personal contributions needed to develop the specialization process. But half of the group, and that's why we're here today, said that assistance from the IOPTP would be very beneficial to them in trying to develop specialization in their country. So we're hoping that this webinar gives you a beginning thought of, what IOPTP has collected, and that as we move forward in IOPTP, we'll hear from those 5 respondents or anyone else who would like to develop specialization. What can we do for you, or what resources do we have? And again, there were some other things. So, okay, Yasser. So what we learned from the second survey, and again, thank you to all of you who filled it out, is that more member organizations are working on developing specialization than they were certainly in 2016, 2020, early 2024. We learned what people perceived as the benefits and challenges of specialization, and what resources they have used to support their development, or what resources are needed to better support development. And at this point, I think we'd like to open it up for any questions from the audience. And I know Carissa's been holding things from the chat box. So if you have questions about our surveys, of how we got to this point and sort of what was the impetus for this webinar, Carissa, I think we're ready to take those questions now. And if you have a question and you haven't put it in the chat box, please feel free to ask.
Yep, as of right now, there's no questions in the chat box.
Okay.
Great.
We'll give people a few minutes. If you have any questions about the process, please let us know. We can also hold on till the end if you'd prefer to do that. So we'll give it a minute or two, let people kind of stretch in their seats.
Let me make a comment, Donna, so everybody will know. We're recording the webinar, and it will be posted on our YouTube, so that if you want to go back, I see some of you looking and trying to jot some things down as Donna was talking. You'll have access to the PowerPoint, so that you can go back and review the PowerPoint to have that information. I know it's a lot of information in a short period of time, but you will have access to be able to go back and look at this. And I think there was one question, they weren't, some people were not able to get the QR code. We'll put it back up again for your attendance. We can get that back up so you can scan it for some of you who came in after the first slide.
Yep, I put the link in the chat as well, and I can put it in there again for those that have entered in after the fact that I put that in there. So, but we'll also, yep, there's the QR code as well for those that would like to have a certificate of attendance.
Okay. Well, I
So,
think you have no
Donna,
other questions. Yes.
there is a question from Mari Carmen Lillo from Spain. Thank you for your presentations. They are very interesting. I have a question. Are there any requirements in any country regarding the use of evidence-based practices for specialization?
I'll refer to Barbara and Yasser also, but as far as I know, that was not specified. And I know it's encouraged within parent organizations that we use evidence-based practice. However, I don't know of anyone who has implemented a process for how to measure that within those people, other than when you submit a portfolio review, they can look at, are you using the best supported developmental or assessment procedures? Are you using intervention procedures that are considered best evidence? And so within the portfolio review process, there is room for that. And as you saw, there were some countries, even for initial specialization, that looked at a portfolio. And certainly many countries look on their renewal process for specialization as to your portfolio and how comprehensive is it. And at that point may have individual points or individual assessment potential for how well you're using evidence-based practice.
Donna, I would make an additional comment about that. And the examination process, specifically for the US, the examination is not just facts, it is patient-based, so that you are having to apply evidence-based practice. So the requirement for evidence-based would be measured, your use of evidence-based practice would be measured through the examination process. And as Donna said, through the portfolio review for re-specialization, when you are talking about certain cases, patient, how did you approach certain patient problems or management, would reflect whether or not you're using more of evidence-based practice. Yasser, you're even more current.
Yeah, I echo what Donna and Barbara said. I just recently, a few months ago, I completed my recertification process. And as Barbara and Donna mentioned, in the portfolio, there is a patient case. It's a lengthy case that you have to write. Then there is one item where we actually talk about use of evidence. How do you use the evidence for examination, for coming to the decision, and how you use the evidence to support your intervention that you used.
Thank you. There's also another comment in the chat box. Thank you for your presentation and time. We would like to start the process of developing our specialization. I'm not entirely sure where this person's from, but please give us a starting point.
Okay, so I think Barbara is going to actually tell you how things started in the US. And I believe the best starting point is to really have a good feeling and define for your member country what is the starting point of pediatric background for the entry-level physical therapist. And once you have that, you can say, in our country, people come into the profession able to practice pediatrics, not able to practice pediatrics, what do they need? And then how can we differentiate between the specialist and the non-specialist pediatric clinician? Who is the novice clinician and what are their basic skill sets? And then what would define specialization? So I think that's the best starting point, is to really understand how people enter the profession or enter pediatric practice. And it varies from different countries. Some countries, when they said, you know, what is needed to even apply, some of the other comments included things like a master's degree with approved pediatric courses in our country, or, you know, a term paper on pediatrics. There are many different options, but I think the first thing is to understand what's the difference between those people entering pediatric practice and those people who have advanced standing. And I know in the US, that's something that's reviewed like every 10 years, and a national survey used to go out to memberships. I'm going to refer to Yasser to see if it's any different, but to revalidate those advanced competencies as compared to basic competencies. So Barbara, are there any other questions you saw? Oh, here we have a comment from Canada.
Yep, it is similar in Canada in the case reflections. Translating the evidence into the case reflection is expected and looked for. Furthermore, it is also expected in the 3 case discussions in oral presentation. I think she's responding to maybe Nikki. She says, in Australia, I'm aware that for both titling and specialization, the assessment panels will assess the use of evidence-based practice with the clients and in the reflections submitted in the portfolios.
Okay.
Yeah.
Great. Okay, we'll have plenty of time for questions later also, so keep them in mind, but let's move on to Barbara and let her tell you a little bit about the next part. Where are we? Yasser, can you get us back to our slides?
Same slides?
Yeah.
Yes.
Okay.
The history of specialization. That'll be the next set of slides.
Next set. Yeah.
And so what we're going to do now is move into panel discussions. And we're going to start with those countries who do have specialization, so you can kind of see the process that we went through.
Okay. All right, we'll start with the next slide. Yasser. Okay, and the next one. Go ahead and start the next one. Okay, so I am going to date myself for all of you. Specialization started in the US in 1981. And I was on the first pediatric specialty council in 1981. So I was, there were 3 of us who were appointed to develop specialization, pediatric specialization in the US. Initially, we had to have approval by our governing body of the American Physical Therapy Association for our petition for the establishment of a specialty area in pediatrics. So we had to have the approval of our, as we would call it, our parent organization in the US saying, yes, pediatrics does have specialization. You have to have, if you are a specialist or have are identified as advanced practice in pediatrics, these are the areas in which you have to have advanced competencies. Now, in June of 1981, this was the start of specialization in the US. There was not specialization for anyone prior to that time. And the 4 areas that were identified as having advanced competencies at that time was cardiopulmonary, sports physical therapy, neurologic physical therapy, and pediatric physical therapy. We were the first 4 areas, and we were able to do that only after we were able to identify that there were advanced competencies in our area of practice. So the areas that were shown were to have advanced competencies were prevention, and remember this was 1981, prevention, physical examination, treatment design and modification, treatment implementation, education, research, and communication. Now, those were general. That could have been areas of advanced competencies, could be parent education, not just education of the clinician, but an advanced area of competencies. So that was in June of 1981. It was approved in August of 1981. The Pediatric Specialty Council was set, as were the specialty councils for the other 3 areas. And I talk about the other 3 areas because we had a group of specialty councils that were working together. The Pediatric Specialty Council was not working in isolation because at that time we were all having to work on further delineating entry-level competencies and advanced competencies. Our governing body said, yes, we can see that there are advanced competencies, but we had to come up with very detailed description of what are these advanced competencies. Because by identifying the advanced competencies, could we then identify what types of questions would be on the written examination? And everything was tied back to those special areas in terms of the examination. So we had to further delineate entry-level PT competencies in pediatrics. A second point that we had to do as the specialty council was to develop a review process, a portfolio. Remember, this was at a time where we did not have any examinations. The examinations had not been developed. So we had to look at a portfolio of the applicants to make sure that they presented themselves as being the advanced practitioner. I kind of smile and laugh about it. Donna and I were talking about it because she was one of the first four. And that was, we would have file boxes of materials mailed to us from the applicants because they had to present so much documentation that they truly had advanced competencies. They had to prove through their portfolio, and the portfolio could have been cases that they presented to us. It could be evidence of continuing education that they had achieved. It could have been certifications that they had received. So it was very, very intensive review of the applicants because we had no other way to identify whether or not these individuals were truly specialists or had advanced competencies. The examination had not been developed at that point, so we could not just depend on the examination. And when I say the examination had not been developed at that point, by the time that we did have the portfolios coming to us, we were in that third area of identifying areas of written examination and developing an examination with the oversight of a psychometrician. Part of that was to identify and train item writers for the examination. The specialty council did not develop the whole examination. We had item writers in each of the areas that had been identified as advanced competencies. So item writers, we had to identify and then train people to write the questions for the examination. Then the final was administering the examination. Now, if you look at that, it says, okay, that's what we have to do in terms of the steps. It took us, next slide, Yasser. It took us a long time. We were appointed in 1981. Susan Harris was from Washington State. Meredith Harris was from New York, and I was from the middle of the US. So we did not live in the same geographical area. And at that point, and again, I'm going to date myself, there wasn't a lot of emails going available. So everything was written, everything was correspondence. So at least that step is gone for those of you who are beginning the process now. It's much easier to communicate with each other. And so it took about 1.5 years to have the entry-level competencies in pediatric physical therapy position paper was adopted by the APTA governing body. So they approved us in 81. In June of 81, it took us till February of 83 to pull together what are entry-level competencies versus what are advanced competencies. And then we had to present that and be adopted by the APTA governing body. So that was the first step. And Donna talked about that just a few minutes ago, about where are you in your country? Have you identified the entry level? What are the competencies that everyone must have at entry level? And then what are the competencies that are different, that after you've identified that entry level, then you can go to what is different for those advanced practitioners. You have a step up already in this day and time because IOPTP has been able to identify what is core and essential competencies. So there's a document that is there. It may be a little bit different for your country, but at least you have an international document that you could look at to say these are entry-level competencies and work from there. The competencies that we identified were a little bit different than what came from our governing body in 1981 at the beginning. So we had screening, examination, treatment design and modification, treatment implementation, consultation and communication skills, referral and evaluation of community resources, the norm reference test, not just clinical observations, not just evaluations developed by the practitioner, but knowledge of normed reference test, and then unique pediatric conditions. So that was in February of 83. Once we got that approval from our governing body, then we went full out in developing that examination, our portfolio review, and then starting to look at applicants for the process. I want to go back and just look at in the process. We chose not to have a practical examination as a part of our certification process. We did that at the recommendation of the psychometrician that we worked with, because the practical examinations is the least defensible part of any certification. There is, I don't want to say bias that comes in, but it's very hard to have every applicant to be tested by the same group of people. So there could be bias in terms of how that person is evaluating the applicant on their skills on a one-to-one basis with that child. You also could not have enough children to represent enough cases to have a good practical examination. So even as in the US, as we went forward, and even with orthopedic specialization, there is no practical examination that is a part of the certification process. A second point I would make in terms of, as we were looking at who might be our first individuals that come forward to be certified, we had a number of people in the US that were certified in certain areas, and I'm going to use NDT as one. Individuals who were certified as NDT said, we're already specialists. We should automatically be, and in our country, we would say grandfathered in as a specialist. And our answer was no. The pediatric specialization in the US represents not just one age group, not just one diagnosis. It encompasses children with a variety of ages and diagnoses and need for interventions. So just because someone is certified in a certain area, they did not automatically come in as specialist. I will tell you that it was very difficult for us. We had a lot of people that got very upset because they felt that given their years of experience and their specialization, that they automatically should be identified as a specialist. And they weren't. Because we were looking at the specialists being able to not be so narrow in their focus, but to be able to practice in all areas in terms of specialization. So that is a pushback that we got. We're not getting that now, 40 years later. We don't have that, but that was initially a problem. The other question, and we made it very clear when we started this process, was that this was clinical specialization. We developed the model in the US to recognize that clinician who might not want to go back and get a PhD or an EDD or to be on an academic faculty. Those individuals, this was not developed for those individuals in the US. It was developed to identify those clinicians who had advanced skills. Now, it has changed a little bit over time, and Yasser will talk about it, and so will Donna, that we have a lot of academic faculty who are specialists, but many of them became specialists, and then that advanced their career so that they became academic faculty and still worked in the clinic. Donna had talked about that recertification, and the recertification was to make sure that that individual, as they were recertified, still were physically active in the clinic. If you had the clinical specialization, are you still continuing to have those advanced skills? So some of the criteria for selection of the people that actually sat for the examination was making sure that they were not so limited in their focus. And one of the things that the specialty council did before we even gave the first exam was that we came up with, and Donna, you may help me with this. We came up with written material about resources saying this is the area you're going to be tested in. And these are some references or some articles you might want to read, research articles. This may be something you need to get more advanced knowledge in. So we had a number of individuals that would go into the clinic and see children of a different age than the ones that they typically worked on, so that they had some skills, let's say in the NICU. I'm going to stop just a minute. Take a breather.
And as Barbara's taking a breather, as you can see from her slide, as she removes her puppy from her room, as you can see from the slide, the first exam was really not administered until February of 1986. Barb, I kind of took over for you there as you were occupied. And there were 4 of us who took that initial exam. So that also dates me. And, you know, of those 4 people, there are 2 of us, myself and Jane Sweeney, who are still pretty active in practicing, although I am retired. Jane, I don't know if she's acknowledged retirement yet. I have embraced retirement, but I do quite a bit of service work globally. So Barb, you can jump in.
Okay, next slide, Yasser. Okay, so once we developed the examination, the Pediatric Specialty Council did that. We were overseeing all of our specialty councils. Our body that we worked with was the American Physical Therapy Association Specialist Board of Pediatric Specialists, ABPTS, American Board Physical Therapy Association. So our specialty councils did not work in isolation. We worked together. We were organized, overseen by a body within the APTA. And that started in 1985, that overseeing board was established to help all the specialty councils be consistent as to how they evaluated the applicants. The examinations, working together, we were able to cover the cost. And we'll talk about, Donna talked about the cost, but because there were a group of us going through together, we were able to share the cost of the specialization so that each of us didn't have to reinvent the wheel, so that we could work together in terms of coming up with the process. So this was set in 1985. The first examination actually was given by cardiopulmonary, and they were about 6 months ahead of pediatrics, and then neuro, and then sports. So those were the first 4 in the US. And now we have many more. A couple of other comments. How did we fund it? Well, we had some funding from our parent organization, but we also did some dues assessment of our members to help us as we went through the process. When we had our first specialist, and even a couple of years later, we were still wondering whether or not people would actually apply and become specialists. Was the investment worth the outcome? Well, now we are many years later, and as you can see, in the US, we have almost 3,000 specialists, and a number that have become recertified over time. Overall, 40,000 physical therapists in the US are certified in one of the specialty areas. Okay, Yasser, next slide. Okay. So when we look at why people become specialists, and over time, the specialty councils from the start in the 80s until now, there's surveys that are done of the specialists asking them about why are you becoming a specialist? What's the benefits? We didn't know. We thought we knew what the benefits would be, and some came to fruition, others didn't. But I think most people think that the benefits are it deepens their knowledge base. It elevates the standards of practice. And some of the things that were specialty competencies or competencies where we were considering them as specialists now have been incorporated into the entry-level curriculum. So over time, certainly what was identified as special competencies back in the 80s, 90s, and 2000s have to be replaced because now we have students that are coming out with those as entry-level competencies. So it's not a static base of information, but it's constantly changing. And that's where the evidence-based practice, as we get more evidence-based practice or more information about what is evidence-based, then the examination process is going to have to change. And we have to show that the person who's the specialist is exceeding the standards that would be entry level in their program. Enhance patient care, and then career advancement. And I've mentioned that before. We were not sure when we started the process. We couldn't say to the applicants, this is going to increase your salary. This isn't going to increase your income. We thought it would. You know, we were hoping that that person that sat for specialization would receive some monetary compensation. And I think the next slide that Yasser had pulled together is there is a increased earning potential, but I'm not sure that that was the driving focus or factor when people went for clinical specialization. And Donna can talk to that just a little bit more. Professional recognition certainly was another item that we know that people get their specialization because it lets their peers, it lets patients know that they are a specialist. When we first developed the process, we said not everyone probably will become a specialist. If you have a clinic and there's 10 people, not all 10 need to be specialists unless they all want to become specialists. But it may be that at the practice that some individuals are specialists and they are the consultants, they are the leaders that the next bullet there, they're leading the profession, and they're leading the profession at their clinical site within academia, as well as within their community. So those were, I think, the main things that were identified, and I'm making sure that I've covered everything. So I think that gives you kind of the history. I think I hit some of the major points. Donna, you or Yasser want to add anything into that?
Nope.
No, I think we're good. The one thing, sorry to interrupt, but I want to make sure we think about this. We have one panel member who may need to leave early, so I tried to send her a message and see how much longer she can stay, but we may move her presentation up to make sure she can tell us about her country. But I'll let you continue there, Yasser, or...
That's
okay. So this is the last one for me, is the challenges. So our early challenges, those of you who are thinking about specialization, you have to rely on a lot of volunteers because of the cost of the process. So the exam committee review of the applications, writing the items for the test takes a lot of time. And not everybody knows how to write a good question for a written examination. And then the other challenge we had when I was on the Specialty Council and on the IOPTP was recertification. But I didn't have to work with that because I was off the board and on the APTA board of directors by that time. So had moved out of that role. But So I will turn it over to, I think, Yasser, you're next.
Thank you very much, Barbara. So, as Barbara mentioned, when we started in 80s, it was only for specialty. Now, the Specialty Council is really looking every year at possibility of adding more specialty. So we started with 4 specialties that were cardiopulmonary, neuro, pediatrics, and sports. And now we added more specialties. So we have in US, we have 10 specialties at this time that include cardiovascular and pulmonary, clinical electrophysiology, geriatrics, neurology, oncology that was added recently, orthopedic or musculoskeletal, pediatrics, sports, women's health, and wound management. And the bottom 2 also were added. And wound management is the most recent one that was added to the specialty areas. And as I mentioned, the Specialty Council is looking and revising those 10 to see if there's possibility of adding more specialty. At this slide, I'll talk about how people can start the process of getting their board certification. So that's just for initial certification requirements. They need to provide evidence of 2,000 hours of direct patient care in the specialty area. So I just need to clarify, what does this mean, 2,000 hours in the specialty area? If someone is practicing in a hospital settings where they see adult with a stroke, people with shoulder problems, and pediatrics, the only counts toward the 2,000 hours are hours that are in pediatric practice. So if someone is seeing 100 hours of musculoskeletal or stroke, those do not count towards the 2,000 hours. The other things about also direct patient care, if there is if someone is practicing, they do 2,000 hours, or a couple of thousand hours, but they're not doing patient care, directly touching patients or working with patients. So there might be administrative rules that doesn't count towards the direct patient care. So in essence, we need 2,000 hours in the last 10 years prior to application that direct patient care working with pediatric population. So they need to be within last 10 years. Also, the council make sure that the hours are really most recent hours. So they look at 25%, which is of those hours must occur within the last 3 years to make sure that people are still current in their practice and have hands-on until recent point before they apply for the certification. Then the applicants will go through a national exam that happen once a year or during a specific period of time. So they have a deadline in July where they apply. The council will review application to make sure that they're meeting the hour required, including the 2,000 patients, direct patient care, and also that 25% that need to happen in the last 3 years. And if all is well, the candidate will sit for a national exam. National exam is, the council does not write the national exam, they oversee the exam. They recruit people who are board certified already in the specialty area, which in pediatrics will be people who are board certified in pediatrics, to come back and write exam questions that mainly based on evidence. They train them, because I was one of the item writers at one point, they train us first. Then after that, they start to, we write exams. Exam can be reviewed by a team leader, then by another level of review. Then they go into the board or to the specialty council. They invite the statisticians to look at the questions, psychometric properties. Then they start to run the exams or the questions in the exam. People who will be certified, they will be certified for 10 years. Then they have to get recertification again every 10 years. So the process of recertification is a little bit different. Applicants who will apply for recertification have the 2 options. One, to sit for again for the long exam, which is I believe 7 or 8 hours at this time, or portfolio. So if they apply for the patient for the exam, they still need also to meet some hours, as you might see here, that's each 3 years. the applicants for recertification need to provide evidence of direct patient care again, and it happened every 3 years to the last year before the recertification. If they sit for the exam, it's just a short portfolio. If they don't sit for exam and choose not to sit for the exam, then they write portfolio. The portfolio will include evidence, one, that they still meeting the hours of direct patient care in the specialty area, which is pediatrics. They substitute with like a point system where they have to provide evidence that they do teaching in the area. If they do teaching in one of the universities, they have to provide evidence that they do services in the community and professions. They have to provide evidence that they do also scholarship as well. So if they meet these requirements, they submit their application. Application will be reviewed by specialty counsel to make sure that they are meeting the portfolio requirements. Additionally, both categories, people who will sit for the exam, people who write choose to do the portfolio without sitting for the exam, they have to talk about a patient that they already seen or see recently and provide a detailed reflection of the patients, including starting from the EBTM model of practice. So they talk about the history, talk about examination, evaluation, diagnosis, prognosis, intervention, follow-up as well. Then the right reflection about how they use the evidence, how things are reflected in the ICF model as well. And this reflection paper will be reviewed by the council as well. One other thing about both of them, that this just started last year, regardless if they will sit for the long exam, that 7-8 hours exam, or they will choose the portfolio, both categories also will sit for another like 1 hour in-home exam. That's just a new, and I need to take it next few weeks, but I heard like just they get 50 questions, which is different than the long exam, and people are able to do it. It's open book exam as well. And that's a process for recertification after 10 years. Now I'll hand it to Donna to talk about her experience as one of the first 4 specialists in USA.
And I have mentioned much of this already, and I'm going to hurry. And I'm going to advise Yasser and Carissa that when I finish, we're going to switch over to Darrell from Israel because she needs to leave us within the next 20 minutes. She's one of our panelists on countries developing specialization, and I do want her to be able to present the information from Israel. So the whole thing that for me was just to acknowledge and evaluate my knowledge base in general pediatric therapy. And by this time in '86, I had just begun a career in academia, but certainly I wanted to support the development of specialization. Yasser, the next slide. And it did give me some recognition, both to the professional and pediatric and the public community. It supported me as a bachelor's degree faculty member in an entry-level curriculum. And for me personally, what was important to me is it opened the doors to a significant amount of global volunteer opportunities and for continuing ed teaching. Next slide. I did serve on the first pediatric specialty council made up of specialists after Barbara and her colleagues departed, and later went to sit on the American Board of Physical Therapy Specialists, where we began looking at, oh my gosh, what do we do to revalidate our competencies, to develop the recertification process? And it was a very lengthy process with lots of questions. So for all of you starting out, just, go for it. And just know you have a lot of evaluation and planning to do. Okay, Yasser, next slide. Okay, I'm going to hold off on this part of questions. And if Dorel Shapiro from Israel wants to unmute herself and share her screen with her PowerPoint, we can do that. Dorel, can you share your screen? Or introduce yourself first.
Yes, I'm Dorel Shapiro. I'm from Israel. You see my screen now?
Yes, it's perfect.
Okay. maybe now it's better.
You're good.
Okay, I'm good. Yes?
Yep,
You
perfect.
see? Oh, okay. So I'm Donna Shapira. I'm from Israel. I'm the head of pediatric interest group in Israel. And I want to talk about the expertise in physiotherapy in Israel. Today is the Memorial Day in Israel, and we hope our hostitude will come back to your family and the war in Israel will end. And we start. We start in the history. The physiotherapy profession began developed in 1940 in the British Mandate in Israel, and they took care and support the injured soldiers and polio patients. And in 1964, this status was regulated under the supervision of the Ministry of Health. And in the 80s, the physiotherapy become academic, was as required academic training. And there are 5 academic institutes that training physiotherapists. Today, physiotherapists in Israel are licensed and the professional who complete the academic degree and pass national license examination. In 2008, with enactment, the health professional חוק מקצועות הבריאות, the physiotherapy was formally included within the law, included the Article 16, which empowered the Minister of Health to define area of specialization and consider required to obtain a specialist certification. Despite the fact it's past almost 18 years from the law from 2008, when the law was enactment, specialists in Israel were not been regulated yet. It takes time. There is a saying in Hebrew that said the same that the faces are different, the ideas different, and so we have to discuss more how to take time that we will have a specialization in Israel. And I saw in your elections and your presentation that in the US it takes time also. So we're okay. So I like I like medical nursing. The physiotherapy profession in Israel does not currently offer formal specialization. Every physiotherapist who completes 4 years of academic study specializes in formality through elective courses and accumulate clinical experience. My father have a knee pain, and he always tell me, I have a knee pain, and you are my daughter, you are a physiotherapist. Why you not treat my knees? So I'm always saying, but I'm working pediatric. I was in children for 30 years. I can take another physiotherapist that the orthopedic, they treat your knees. Now, if you will be a specialist, I can say I'm a specialist in pediatric, and you have to take a physical that specialize in orthopedic that treat you, and not say why my daughter not treat me. So in 2005, the Supreme Council of Physiotherapy was established. The council is included, represented from all the physiotherapy association. There are physiotherapy from the Ministry of Education, from Health, from Welfare, the IDF, the IPTS, the academic institution, the hospital, and the health fund. The Supreme Council is an advisory body, and they not have authorities to decide about the law or decide about the specialization. They only give it advice. In 2012, dedicated community formed in the Gulf to to propose a framework of advancement of physiotherapy specialization. Currently, physiotherapy and other health professions are subordinated to the head of medical division. Academic training program are managed by the Malad, but it is a Council of Higher Education. However, the health professional lack full autonomy regarding training program and license processing and remain under the oversight of the Ministry of Health. So the 10 area of specialization was offered since 2012, and there is in the law, in the health professional law, the health the specialties that offer are musculoskeletal rehabilitation, cardiopulmonary rehabilitation, pediatrics, geriatrics, oncology, women health, pain, sport injury rehabilitation, neurology, and rehabilitation, and mobility and technologies. So the purpose, especially the track that suppose that that be a training phase to our physiotherapy specialization that's called the foundational generation. Dora Meyazdin, foundational generation. What is the foundational generation? This is a physiotherapist, veteran physiotherapist for the foundational generation will be granted experience status, and there will be specialists go at be specialized and the first specialized in Israel. This transitional period allows physiotherapists from any field who meet established criteria for specialization to be recognized for their qualification. However, since the specialization had not been formally legislated under the law, the professional physiotherapists they can be in the foundation generation can't call specialties yet. Physiotherapists recognized as expert will serve as a mentor, guiding the physiotherapist that's seeking specialization. Training will be placed in a designated center across various fields, overseeing professional community responsible for the direct and supervision of specialization process. So the purpose to admit a specialization track in physiotherapy, some candidates must meet the following criteria. They have to hold master degree of physiotherapy or related fields, to have at least 5 years of professional experience, have 3 years of experience, especially in the chosen field of specialization, have 3 years of experience in training students or mentoring young physiotherapists, complete 120 hours of coursework related to the area of specialization. Internship and training progress require complete 2,000 hours of practical work in the field of specialization, complete 200 until 240 hours of theoretical studies, complete 96 hours of supervised training, but they export from the foundational generation. They got the specialization without this program. Successfully pass a final exam at the end of the program. So, given a significant investment of time and financial resources required to achieve the specialization, is appropriate that Specialization physiotherapists receive both public recognition and economic compensation for professional status. Specialization will expand the physiotherapy scope of practice, allow for direct access to physiotherapy service without physician referral. In Israel now, there is directed access to the physiotherapy, but not in pediatric. In other specialized in physiotherapy there is, but not in pediatric. Pediatric, we need the doctor. In the future, we hope the PT will ability to refer a patient to imagine to X-ray and give them a decision against pain. Specialist physiotherapists will grant broader professional opportunities, enhancing the role within the healthcare system. So we have some dilemmas in this process, and I want to share. One is the definition of pediatric field. In Hebrew, there are not a correct name that for pediatrics. So what is the population and ages of group that are included in pediatric? Preterm infant, children, adolescents, that should divided to be an age group of diagnosis. How we are define the pediatric field because it's so broad. Overlap between the health professional. How to clearly define the physiotherapy unique scope. About overlap with the OPT and speech therapy and medicine, like physiotherapists, they have specialists in some area that occupational therapy, then they learn it also and they also give a treatment in this area. So what is the unique scope of, for the physiotherapist? And there are sub specialization in physiotherapists. Should pediatric physiotherapists be divided into sub specialty or not? Because if you teach children, you don't treat only his knees. You teach children in a space of neurology, in orthopedic, in respiratory care, in oncology, in neurology. There are a lot of area. So if you are pediatric, you can treat all this area. Yes, no, it's a dilemma. Require clinical experience. It's said that you have to have 3 years of experience in your specialization to get your specialization. So where should the professional gain experience? In the rehabilitation, in the development institute, in the hospital, in the schools. Okay, and this all dilemmas we cope when you sit together and try to advance a specialization in Israel. So thank you for your listening, and thank you for Nili that helped me with the presentation, and to Yael Wotem for the Ministry of Health, and to IPTS. And it was short. I hope you understand, and if you have questions.
You did great, Darrell. Thank you. Thanks a lot for your presentation, and for other people, we'll take a few minutes here to get regrouped, and I believe that Ingen can get started getting ready because I think she's next on the panel for people who have specialization. If there's a quick question for Darrell, we can take it, but I know she has to leave. And if not, if we get other questions for you, Darrell, we'll try to figure out a way to communicate them to you and let you respond.
Okay, thank you. I will be in the phone. It will be
okay.
See you. Thank you.
Okay, so again, apologies to the participants. We're doing this kind of jumping around, but I wanted us to hear from Israel. And at this point, we're back to people who have had specialization, and Ingunn from Norway is going to present. She has been as active for as long as the US or her country has, maybe not Ingunn, I don't know, she may not be as old as Barbara and I, but we'll let her take it off from here and show us, talk to us about what Norway has done with relation to pediatric physical therapy specialization.
Okay, can you hear me now?
Yes.
Yeah, okay. So thank you for asking. Come and present. I am not the expert on this, but I know, I'll tell you what I know. And then I might have
That's
one of
great.
my Physical Therapy Association specialist committee leaders listening in. So I've asked her to join, like, help me if there's something I cannot answer. But I just took those questions you had, and saw what I could answer. So the first question was, it's a description of the process for specialization in Norway. So first of all, what is a specialist? And let's see. So like the definition of it is, so according to NFF, which is our mother organization, a specialist in pediatric physiotherapy has an in-depth knowledge of children's movement and development and of children's cognitive, social, and emotional development. The specialists use this as a basis for investigating, assessing, treating, and implementing health promoting and preventative activities at the individual and group level. So, and people who come to do a specialization, it's very varied what their backgrounds are. But there's a series of competency goals that are reached through documentation of education, clinical experience, supervised practice, and supervised experience, which we call hospitering. There's not a word for it in English, really, but it's kind of visiting with another work site and coursework. So I thought I would just go through those different requirements. So for education, like to become a PT to begin with, you have to have a bachelor's degree in PT, like 3 years, and a 1-year internship. And you work in community health and specialty healthcare, so hospital or community, half a year each. And then to become a specialist, you need a master's degree. And it can be like physical therapy specific or health related. And based on which kind, it changes how you go on further. So education is one part, and then it's the clinical experience and supervised practice. So you have to have a minimum of 2 years clinical practice in pediatric physical therapy before you start your specialization. Lots of have had much more than that, I would say. In addition, so if you have a clinical master in physiotherapy, you need 30 hours of supervised practice for a year. And if non-clinical health related master, 60 hours of supervised practice for 2 years. And they have to include neurology, orthopedics, so certain fields there. You'll have to tell me if there are any questions, because I'm just I won't see it when I present.
We'll keep you posted. So
yeah.
If anything comes up, Carissa will let us know.
Yeah. So that's the practice side, and then it's this supervised experience that we call it. And it's just that you have to visit with another field. Say if I work in a community setting, I'll have to go to hospital for 10 or 20 days, depending on which master's degree I have. If I have a clinical master's, then it's 10 days. If it's a non-clinical, then it's 20 days. And then there's some coursework, just a course in supervision through the mother organization, 24 hours, just how to supervise students, parents, children. And then you have to document continuing education or development for 200 hours for the next, to be recertified in 7 years. So, and I have to say, like, it has changed a lot, because I finished with my bachelor's in 98, and I started on the kind of the old path for specialization, which changed in 2010. So since 2010, it has been more like a master's as the like one of the requirements. But I thought I would just show you quickly like the competency requirements. And we don't have to read, but this is like big, what can I say? Like, it's just like an overview what you have to be able to do at the end of your specialization. I don't think it's so useful to go through each of these sentences, but you can, I don't know what do you think? Or
No,
it's
I
more
think
like,
it's fine. People have a good chance to see this. And as we said, this will be available on our YouTube channel. So if people need to go back to it, they'll be able to.
yeah, because then they can see like the wording it's translated, it might not be quite accurate, but it's there's some knowledge requirements though. This is what you should be able to do at the end of your specialization. And then there are some requirements for collaboration and supervision guidance. Yeah, what you're supposed to be able to do. And also for professional development. Obtain new research knowledge in the field of and systematized experiences as a basis for developing one's own professional practice. But I have to say, as I was going through this, making this presentation, I'm like, how can you even evaluate this? How can you even, like, how do you know that that's achieved? And on many of these, and I think that's maybe where the IOPTP could be helpful, saying like, how do you assess these things?
Great.
Yeah, because now it's kind of up to the supervisor and the board that evaluates at the end before you get your specialization. And for us, that's the physical therapy association, like the specialty board. Yeah. So as I told you, like when I started as a physical therapist, it was totally different requirements, because then everyone they didn't ask for a master's degree. And then based on the fact that it became a master's degree, they took away some of the old requirements. And we are discussing that right now, because we are looking at the specialization process and thinking, are we doing the right thing now? Did we lose something in the process since we took away the courses? Because our physical therapy organization has courses for continuing education. And one that was always required before was like the age 0 till 18 physical therapy development, like a week course. It's actually 2 weeks, a week coursework in between with supervision, feedback from your course leader, and then another week. So that's like now, since the master's degree, we're not requiring that, but we're thinking, should we ask for that again? And maybe that would replace some of the supervised practice. I don't know. So that's a question. And so because what they had before was like, it was based on hours of relevant courses or study points, work experience, and professional reflections, peer-based supervision to the requirements as described. So different process. And the competency goals for each specialization is continuously updated by the special interest groups in the Physiotherapy Association. So that would be us, our pediatric group. And just going through them now, like, we have to go through them again. And we are working to obtain a specialist certification administered by the health authorities instead of through the PT Association. And actually, our Minister of Health just at our Congress here in the Physical Therapy Congress said this is something we're going for. So it sounds like that's in the process of actually happening. And then we'll get the protected title as a pediatric physical therapy specialist. But then you asked about the benefits related to the specialization process. And it is kind of what you said, that it's more like for knowing what you know, being able to, you get a title that you're a specialist and you can be a better therapist, hopefully. But apart from that, no general rules for like salaries. You might get an individual, rise, but not necessarily. And actually, if you get a master's degree, though, many communities will reimburse you for that or will give you a higher salary for that. So then it's like, should I also become a specialist because I already got my master's, which is what they pay the same for, because that's for all occupations. You can have the bachelor's and then the master's. The specialist title through the physical therapy organization is a little bit on the side of everything else. So it might be harder for them to understand how you should reimburse that or make it more interesting in a way. But I know that some in private practice, you can get more reimbursement or higher reimbursement rates if you have a master's degree, again, not a specialist title. So I think if we get a publicly authorized specialization, it will change it. Then it will probably be more attractive again. Although every year the physical therapist organization has about 20 new applications for all the different fields, and a few of them pediatric too. But I will say it has, since the new system, it's not as interesting to people anymore because it's a lot of work and it costs something. So that's challenges faced in the specialization process. It can be expensive if you have to pay for the supervisor yourself. Maybe in a community setting, if I work in a community with several specialists who are able to supervise as a part of their job, then it's not expensive. But if I have to hire someone to be my supervisor, that's rather expensive. Because as you maybe remember, it was like 30 hours for a clinical PT master and 60 hours for a non-clinical master. So I think that's one of the issues. And then for the internship or the supervised experience, I call it, for those 10 or 20 days, you might have to take time off from work. So that costs something, and you might have difficulties finding supervisors in the same geographic area. So there are some obstacles to this. But I think it used to be, as I said, more popular before the master's degree became something that was more higher rated maybe, or like more attractive. So one thing though is that the Norwegian Physical Therapy Association has a fund, like a big asset where you can apply to get some of the costs covered. But you never know that exactly beforehand. It's not like a guarantee. You have to do the work, send it in, say, this is what I spent. But usually they pay for half the amount of the supervising hours. So that's about what I thought I would say about it, unless you have some questions. Or Anne, if you're there, you should...
There was a question in the chat, Ingun, for you. Are there benefits of having the health association provide oversight rather than the physiotherapy association?
For us, yes, because then it would be like a protected, it's an authorization then, in a way. like just like you as a physical therapist, you are as a physical therapist, you are authorized through the national or the government, with if they also are if they are in charge of this specialization too, it's going to be more, I think, higher in a way. Like it's not just through the organization, higher rated, or yeah. And it will be a protected title, because per now, it's not protected. Like anyone can say, I'm a specialist in physical therapy, pediatric physical therapy. It's not, right? I think that's about everywhere, right? Unless you are authorized as something.
Thank you for that. Barb, did you have something else to say before I go to
Yeah,
the next
yeah.
question?
The question would be, and then, is there licensure, national licensure for physiotherapy?
Yes.
So if you have that, your license, that's through the health authorities, is that right?
Yes.
So the specialization, if it were through the health authority, then how would that be different than what your licensure states?
Because then it just gives you additional licensing in a way, right? Like you have the license to practice, but you're as a special. I don't know. I'm not quite sure.
Will there be separate requirements are you hoping to be able to have your governmental agency require additional requirements to become a pediatric licensed physical therapist?
Or we want them to take these requirements.
Okay, so you're hoping they will adopt your requirements, but offer a regulatory
right
significance to it.
Yeah, that's
So-
what we're thinking.
So the question again, and I hate for
Yeah.
people to have other questions, but so if someone says that they're a specialist and they have not gone through the process that you have set up through your pediatric or through your physiotherapy association, will there be certain penalties if they claim they are a specialist and they are not? Is that where the protection would be through the health authorities?
I think so. Yeah, right. Because then it's a protected title called pediatric physical therapy, pediatric physical therapist. And we don't have that now. I don't know if you have that in the States.
No, we do not have that in the US. We count on the credential from the American Board of Physical Therapy Specialists, but there's no regulatory.
Right.
government.
So, but it sounds like it's going in that direction in Norway though, now. So, but we're waiting. So we have been hoping for that for many years. So,
Thank you for the discussion. There is another question for you, Ingun, in the chat from Mari. She says, thank you. And her question is it compulsory or mandatory, I guess, to be specialized to work in any place of the public health service or public educational service?
no, it's not compulsory. No, you don't have to be a specialist. Like after your bachelor's degree, you're free to apply to any job, and you happen to work with pediatric patients or others, So, and then you gain your experience, but you might want to go through the specialization because you want to say that I'm a specialist in this, it's my field. But that's been mainly the motivation for now.
Okay. Do you see any other questions, Carissa?
Nope. Yes, she just says thank you. That's it right now. So, and I did put a reminder in the chat for everyone. If you have any questions for our speakers or panelists, please feel free to use the chat to write your question, and we'll address them periodically throughout the webinar. We are about 2 hours in, so it might be a good time to stand up and stretch maybe as we bring up our next slides. Maybe, Yasser, if you don't mind putting up the slide again with the QR code, just a quick
Yeah.
reminder.
Then the other thing is while we're taking the stand-up break, the next person speaking will be Misako Yokoyama, and I apologize if I messed up your name, who represents Japan. And I think in contrast to what you've heard from the US and from England, Japan has not had specialization for quite as long. They've commented they've had it for 6 to 10 years. So I think we'll get a little different perspective and look forward to Misako's presentation.
Yes. Before
Thank
Misako, you get going, I just want to remind everyone right now, Yasser has also up on the screen the link and the QR code. If you want a certificate of attendance, you will need to complete that form. And and I will also put it back in the chat as well if that's easier. But yep, I think Yasser, you could probably now remove it and let Misako share her slides. Thank you so much, everyone.
Thank you.
Okay.
So
So
we have a
Misako,
10-minute
are you
break,
with us?
10-minute break before we start.
Okay.
We
Can
have
I-
we have 3 more presenters, so I would make it a 5-minute break so we have time.
5-minute break.
Yeah.
Okay, sounds wonderful.
5-minute break. All right, we'll be back around just after 9.
And before you
Or,
get started,
I guess,
Misako,
just-
do you have any
oh.
questions?
Karen just said some regulatory bodies in Canada recognize the title of specialists and highlight the approved programs. She just wanted to add.
Okay.
All right, see everyone back in a few minutes.
So Masako, before we get started again, there you go. You unmuted yourself. I was going to say, be sure you unmute yourself.
Okay. May I my screen?
And Carissa, are we ready to restart? Barb, are you back?
I'm back.
Okay. I think
Can
we
you
should.
can you see it?
Yes, I can see your screen. It looks great.
Okay, thank you so much. So let me start. It's okay?
I think that's fine.
Thank you. Hi everyone. My name is Misako Yokoyama from Kitasato University in Japan. Today, I will introduce the lifelong learning and specialization system for physical therapists in Japan. Thank you for listening. In Japan, there are about 210,000 physical therapists. 40% are women. To become a physical therapist, you need a diploma after 3 years of education. In Japan, physical therapists cannot directly accept a patient. A doctor must first see the patient and then refer them to physical therapy. Oh, this is Japanese law. Oh, however, in preventive service, physical therapists can be the first contact. Also, physical therapists in Japan do not have the right to private practice or direct access. They usually work in hospitals, clinics, or public faculties. Here is a brief timeline. In 1966, the Japanese Physical Therapy Association, JPTA, was established. In 1970, Japan became a member of WCPT. In 2015, Japan also joined the IOPTP. This year, we are celebrating 10 years of IOPTP membership. In addition, we established our own academic society, the Japanese Society of Physical Therapy, JSPPT. This includes a pediatric group. And next month, the World Physical Therapy Congress 2025 to be held in Tokyo. I look forward to seeing you all. In Japan, a lifelong learning for physical therapists is supported by JPTA. There are 3 levels. Registered physical therapist, certified physical therapist, specialist physical therapist. The certification system for certified and specialist physical therapists started in 2009, and it was revised in 2022. This system helps us continue learning and improving our skills. After graduation, physical therapists first become registered physical therapists. They can then choose to continue their education and become a certified physical therapist, a specialist physical therapist, or both. But it is important to note postgraduate education is voluntary. Once you pass the national exam, you can work as a physical therapist for life, even without field study. There are 2 types of specialization, left or certified physical therapist at the right side of certified physical service specialist, yes, sorry. And so clinical specialization like orthopedics, stroke, developmental disability, and more. So this is left side. So 21 certified. And academic specialization like basic, neurological, pediatrics, and more. So in the clinical specialization for children, physical therapist can be certified in developmental disability. In the academic specialization for children, physical therapists have been able to become specialists in pediatric physical therapy since 2022. However, this point, so same numbers. So the number of specialists in pediatrics includes many who moved from neurological specialization. So the numbers may not fully represent new certifications. As of 2024, about 12% of JPTA members are satisfied specialists, and the numbers is still growing. Also, these two qualifications differ and focus clinical versus academic. They are recognized at the same professional level. Certified physical therapists are strong in clinical practice. They treat patients directly and have high practice skill. Specialist physical therapists are expert in academic field. They focus on research, teaching, and academic presentations. To become a certified physical therapist in Japan, you must join JPTA, have at least 5 years of clinical experience, complete a 30 hours training course, and pass a written exam. There are 377 certified physical therapists specializing in developmental disorders out of 70,145 total. To become a specialist physical therapist, you must be a JPTA member. You must submit academic achievements such as peer-reviewed papers, and you must pass the document review and interview. So there are 331 specialist physical therapists specializing in pediatric physical therapy out of 4,139 total. So, however, this number includes those who are certificated under the pressure system and neurological specialists of physical therapist and were automatically given the pediatric specialty. Therefore, it does not reflect the new system accurately. In Japan, specializing has archived some important benefits. It has improved the clinical quality and the professional credibility of physical service. It has also encouraged lifelong learning and academic growth. However, other expected benefits such as promoting leadership roles or improving public trust have not been fully realized yet. There are some challenges in the specialization process. First, it is very complicated and takes a long time. Second, many people, even some professionals, do not know much about it. Third, it is hard to balance clinic work with extra training. Fourth, the evaluation standards are different across specialists, and we need to fix that. Also, in the pediatric field, the system changed 3 years ago. It is still in transition, and therapists are confused. Finally, we are not sure if the pediatric specialization in Japan matches the international standard of IOPTP. The specialization system is developed and managed by the JPTA. It is aligned with national standards and aim to match international standards. Also, improvements are still ongoing. The system revised periodically to make it easier to access to and understand. Recently, digital platform and structure curricula have been introduced to support learner better. So thank you for your attention. We look forward to welcoming you to Tokyo at the World Physiotherapy Congress 2025. So, okay. Sorry, really. This so beautiful view and castle, temple, and so beautiful blossom. And so good taste of food. So welcome to Japan. Thank you so much.
Thank you, Masako. And I think what is interesting about your presentation, it sounds like in Japan, you have 2 ways that you recognized people.
Yes. Yeah.
Advanced practice is recognized in 2 ways, and you've chosen to develop a more clinical and a more academic track. But you really have a well-developed system that gives people options, but you do recognize advanced practice in pediatrics. That was interesting to me. Thank you.
Thank you so much.
Masako, thank you for that. I did receive one question in the chat. Are the pediatric specialists still involved in patient or clinical care, or is the focus on teaching and research?
Yeah, so both. Really, so the way treatment both, but so specialty. Most if I have specialty of choices, so clinical or academic. I have both specialties, so yes, both is very important. Yes,
that's great.
I think yeah.
Okay. Did anything else pop up, Carissa? Because if not, we'll cover it anymore at the end.
That's it.
And
I have one more question.
Okay.
Okay, for those that you have the certified and then you have the specialist. Does the specialist typically have an advanced degree, a doctoral, a PhD, or you can still do that without having the advanced degree?
Yeah, specialty have a PhD. but so not necessarily PhD. Yes, so so specialty physiotherapists need so paper and so presentation and so teaching, and so this point is very important. Yes.
Okay.
It's okay.
All right. Thank you.
Thank you so much.
Thank you for joining us and for introducing us to Japan. Nice photos.
Yeah. Thank you for this opportunity. Yeah. Thank you so
Okay.
much.
All right. At this point, we want to move back and hear from our panelists who are in member countries who are developing specialization. And I noticed that Johannes is from Indonesia is waiting on the line here, so we'll let him go next. And again, if I did not pronounce your name right, I apologize.
Yes, perfect pronunciation. My name, Professor. So I can share my slides, Donna.
If you have slides and you'd like to share them.
Okay. Okay, thank you. Yeah, do you see my slides?
Yes, they came through loud and clear.
Okay, thank you everyone. My name is Yohanes Purwanto. I'm from Indonesia. I representative of Indonesian Pediatric Physiotherapy Association or IPPPA. And very nice this sharing about our developing process, the specialization worldwide and how in my country, Indonesia. So in our country, we use this definition of pediatric physiotherapy as a specialization in physiotherapy services that applies clinical reasoning and evidence-based practice in assessment, evaluation, diagnosis, and intervention for infant, children, and adolescents with developmental disorder from age 0 to 18 years. Our association, Indonesian Pediatric Physiotherapy Association, or IPPP, established since 2014. It's about 11 years. And our specialist interest group under the Indonesian Pediatric Association, or IPA. So we are accepted as a member of IPTP in 2023 in the World Physiotherapy Congress in Dubai. Our pediatric physiotherapist members in Indonesia is spread out in 17 provinces. Indonesia is very large countries with a wide geographical area, but mostly our pediatric physiotherapy members in the east area, but just a fair few in the east region of Indonesia. All members is 512 members from January 2025. This is the current situation of pediatric specialization in Indonesia. Pediatric physiotherapy is a part of the basic education curriculum pediatric physiotherapy program. There are two times, pediatric PT1 and pediatric PT2. Becoming a member require a special training before as a member and requires at least 2 years of clinical experience in pediatric practice area. We have the annual scientific conference for pediatrics communities in Indonesia have been held since 2014. Currently, our association, it remains an interest group rather than a formal specialty, as a standardized certification examination has not yet been established. And for benefit of pediatric specialization in Indonesia, first, improve the quality of care for patients and their families, and also increase income for our members, particularly for the private practice area. For your information, our PT profession in Indonesia got the direct access from the government in private practice since 2015. But it's like a partial direct access because in a hospital setting, we still under structured by medical profession, but in a private practice, we get the direct access already. And the other is enhance the physiotherapist confidence through the specialized competencies and also brings the physiotherapy profession closer to the community. In our future development of specialization, we hope that pediatric physiotherapy specialization will be developed as a formal education, similarly to other healthcare specialization program. Yeah, for example, like a medical or nursing specialization, and requires a minimum 2 years education, and based on the clinical internship training, can also be integrated with the recognition of prior learning under university supervision. So the rationale of this program, because the first is about the professional reason, we need higher standard of competencies, and also policy related reasons, or we can say like a political reasons, because we need like a formal or official recognition by governments. We need formal recognition by other profession or also from the community. And we know that our hope to be the specialization in pediatric in Indonesia, we have a lot of challenges. Barriers for other professional regarding the direct access, as we mentioned before, that we get already direct access in private practice, but in the hospital setting, we still under structured by medical professionals. And also the lack of available pediatric physiotherapy specialists in Indonesia recently, and educational curriculum is not established yet. The limited research in pediatric physiotherapy in Indonesia. Also, as you know, Indonesians have a geographical challenges. But we have some opportunities because Indonesian physiotherapy standards by government include the specialization level is by government, they have some in health ministry in our government, they are like a specialization level from the profession until the specialist. Indonesian physiotherapy has a collegium representative under health ministry, and high demand for pediatric physiotherapy services. For your information, it's 28.8% children population under 8 years in 2025. So it's a very big population in Indonesia because almost 20% of our population, 280 million population, 20% of them is the children population. And also the global benchmarking and networking support. And I hope IOPTP also will give more facilitation to us. And the last slides, I will give you some other information. For your information, the orthopedic musculoskeletal physiotherapy specialization program was proposed to the Ministry of Education this year. So we hope if the orthopedic musculoskeletal physiotherapy specialization program accepted by government, so it's more easy that for the pediatric physiotherapy specialization will be applied to the government. And 3 members of IPPA or our association have completed the doctoral education in pediatric area, and 4 others are currently pursuing the doctoral study in pediatric physiotherapy, including me. So I'm still finishing my PhD program in National Taiwan University in Taiwan. So Professor Chen, one of my professor here, I think it's also here in Taiwan. And every year, pediatric physiotherapy experts from developed countries are invited to give expert lecture for our members. And our association also arranges a clinical visit for our members to other countries every year. So that's all for the brief information sharing about my for our pediatric specialization in Indonesia and still developing until now. And thank you for your listening. And this is the picture that our annual scientific meeting last year. So record for our pediatric PT from Indonesia. So again, thank you very much for your listening.
Thank you very much.
Okay, so I want to thank you also. And it sounds to me that you're pretty well supported by your government in working with a model towards working towards specialization in your health ministry. And I think it's a plus that one group has already put in a proposal. What I found interesting is membership in your specialty organization appears to require some advanced level of practice already. So you've taken that little tiny step of saying, if you want to be, and correct me if I'm wrong, but to join your special interest group, you have to have some experience base and some additional background than just graduating as a physical therapist.
Yes, Donna, because when we our PT our physiotherapists, when they want to be a pediatric specialty in our association, like a pediatric special interest group, they want to provide like 2 years in the clinical practice and also like education for the profession, then they start to become members.
Okay, so even though you have not finished your specialization process, you do have a way to recognize advanced competence. So I think that puts you well on your way for Indonesia.
Yeah, thank you, Donna.
Carissa or Barb, any other thoughts or comments?
Yeah, I have a question for you, and it goes back, it's too lengthy. That's why I didn't put it in the chat. So when you're developing the specialization, you said that it would be a 2-year academic program and 1-year clinical. Is that?
Yeah, currently we still as like a special interest group. We become a special interest group. We need like 2 years in the practice area, clinical practice experience is one area. But in the future, we need like a formal education for minimum 2 years.
Okay.
Just like similar with the master degree for our specialization, we're hoping for the future.
Okay, so that was the first part of the question. As you're proposing that, you're probably going to have clinicians who want to come into that program for
Yes.
the year. And just kind of think about this. Are you going to give them academic credit for their clinical experience? Will you waive some of the coursework for them? As well as for that clinical? I know a lot of, certainly in the US, we don't have it that you have to have the degree, but in certain programs, they are given credit for their experience rather than to have to take all of the coursework or all the clinical experience. So, okay, it sounds like you've already gotten to that point of thinking about that.
Yeah. Thank you, Barbara.
Any other questions that you've spotted on the chat, Carissa?
There are no other questions, so you can move forward.
Okay, then thank you for waiting. But the next person we want to hear from is Li Chao Chen from Taiwan.
Hello, everyone. Let me share my screen.
Yes, we have you, and
You see it now?
now it's there. It's perfect.
Okay. So it's been very interesting to hear about how people talk about their specialization in their country. I feel like I have learned a lot, and so thank you for having this webinar on specialization. So I'm Li Chao Chen. I'm from Taiwan, and I'm representing the pediatric physical therapy specialization in Taiwan. So before, hold on. Okay. So I'll give you some background about PT in Taiwan. So we started the education program, I think in 1967. And before 1995, it's you graduate from the education, the entry-level education program, then you can practice as a physical therapist. But since 1995, licensure exam is required after graduation. So you need to pass the licensure exam, and it's a written format exam to practice and get the license to practice as a physical therapist in Taiwan. And in the written format exam, one of the key topic is pediatric physical therapy. And also for the entry level program, clinical practice internship is required too. And so after 20 years, in 2015, the Taiwan Physical Therapy Association started to develop specialization. Oh, one thing before is that we don't have a formal pediatric physical therapy association in Taiwan. So it's we have the Taiwan Physical Therapy Association, and we have a small group of pediatric physical therapists in the association. So in 2015, we started to develop specialization. It started with, still currently, we have 5 areas of specialty: sports pediatrics, musculoskeletal, neurologic, and cardiopulmonary. And we are, I mean, after like almost 10 years, we are still developing. So development process. So for the pediatric, the purpose that we wanted to process the specialization is hopefully we can promote the development of pediatric physical therapy profession, and also to enhance the professional standards of pediatric physical therapists so that we can bring better care for our clients. And so we have a panel. So we recruited a group of experts, including clinical practitioners and also academic faculty, to form a panel to discuss about the proposal of certification regulation. We did establish the regulation in 2017, then pause. We haven't had we haven't really started the application yet. So in the regulation, in the certification regulation, so we kind of like establish the requirements. So the process of certification is through portfolio review, no exam. And we have the requirements, we have 5 aspects of requirements, including basics and work experience, continuing education, research, and teaching. So for the basics, these basics are the basic requirements for all specialty. So all areas of specialty. So one must obtain a Taiwan physical therapist license. And also in the past, so also second is to accumulate physical therapy work experience for at least 4 years of full-time work. So if one only did part-time job, then the accumulation of the time needs to be 4-year full-time work. But the physical therapy work experience include not only clinical practice, but also so clinical therapy consultation, but also teaching, administration, research, and development. All these related to all these in physical therapy that would count as work experience. Supporting documents are required. So that's the first part of basic basic requirements. The second part of the requirement is the pediatric physical therapy work experience. So here, one needs to have at least 2,000 hours of pediatric physical therapy related work accumulated in the past 10 years. Among these 2,000 hours, at least 1,000 hours need to be in the last 3 years. And again, the pediatric PT work includes clinical practice, teaching, administration, research, and development, with children as their main service focus, children and the family. And supporting documents are required. The third set of the requirement is the continuing education. For for PT license requirement, it requires at least within 6 years, it requires at least 120 hours of continuing education program. For pediatric specialization, we require that needs to have at least 90 hours of continuing education courses in pediatric physical therapy related course within the past 6 years. The next set of requirement is on research. So an individual should have published at least one research paper or did presentation for oral reports or poster related to pediatric physical therapy as the first author or corresponding author at peer-reviewed journals or scientific conferences within the past 6 years. The last one is the requirement is the teaching experience. So one must meet at least one of the following teaching experience requirement. One is supervised PT internship students for 2 years. The second one will be supervising new physical therapists or young physical therapists for 1 year. The third would be accumulate at least 24 hours of public lecture. It could be lecture to professionals. It could be lectures to public, general public or parents, for example. But the lecture needs to be related to pediatric physical therapy. So at least one of the teaching experience is required. So that's the requirement for the certification. We also require a renewal. For PT license, it requires renewal for every 6 years. So the first initial specialization is valid for 6 years. After 6 years, then you need to renew. The renewal requires continuing education hours, research, and also teaching. So all 3 of them. So that's our requirement. What's not required, but have been discussed is clinical experience. So like I said earlier, we define the pediatric physical therapy work, including clinical practice, also teaching, also research, and also administration. Whether or not, so we do not require specifically for clinical experience, the amount of clinical experience. What's not required is exam. We do not request for exam. And also we do not require the mentorship. These 3, I think, are in the survey and we answer no. So the benefits, hopefully the benefits for specialization is that we would like through specialization, we wish to enhance the professional standards of pediatric physical therapists. By that, so that we can improve our patient or client care, so we can provide better care to our clients. The second benefit is to specialization may promote the development of pediatric physical therapy profession. The specialization recognize PT with advanced experience or performance in pediatrics, and I think that's a very positive recognition, and it also provides a direction for career development of pediatric physical therapists, so that we'll know which way to go. And also, I think it helps to develop a pediatric physical therapy community, which may or would increase the sense of belonging. I think it would bring the pediatric PT more together or coherent. And also, I think the specialization is way of for advocacy to increase recognition of pediatric physical therapy to the public, to other professions, so that we could maybe promote the multidisciplinary collaboration, and also to government, especially when the government is trying to establish some regulations or policies. Hopefully with the specialization, we would be more seen by the government. So these are the benefits that we wish to achieve by specialization. But we do have a lot of challenges. That's why we paused there for many years. First is some of the requirements are still, where we establish the regulation, we set up the requirements, but there are still some discussion and voices about, so for example, whether or not we want to have exam. So we at the beginning or currently we have different areas of specialty: sports, pediatrics, musculoskeletal, neurologic, and cardiopulmonary. The sports and pediatrics do not require exam, but the musculoskeletal, neurologic, and cardiopulmonary, they are still developing the regulations. They are developing exams. I think one have only written exam. The other two have both written exam and practical exam. So that's kind of complicated. And that's actually one question that I want to ask after my presentation, is that whether or not, because we have different specialties, different areas of specialization, whether or not it's better to have similar requirements or process of specialization across different specialties. So if one have exam, but we don't have, whether or not they would make different point of view between these specializations. But to have exam, then the question or the problem will be manpower and cost, which many of you have presented or raised the concerns. And the second concern is about whether or not we want to request for clinical experience. So for example, the USA, your specialization is for clinician, for clinical practitioner. But in Japan, you have kind of two different mechanisms, one for clinician, the other one would be for academic. In Taiwan now, the way that we establish the regulation, it's kind of, we try to cover both, because we would like to recognize pediatric PT working in different aspects in pediatric PT. But I think that's one advantage. But then on the other side, it seems complicated, or whether or not it would maybe confuse the focus, lose the focus of the specialization. So, and the second challenge, or this may be the main challenge, is a lack of incentives or rewards. Why do one wants to get specialization? It costs time, it costs money, and cost for the association also cost the applicants. And because there is, so for the specialization is require a higher standard of your profession, but it does not come with corresponding working environment or salary or professional status. The government does not prevent specialization, but the current government regulations and policies do not encourage specialization. For example, for health insurance reimbursement, there is no different reimbursement between advanced between those with advanced experience or those with just entry-level experience. So, and also in the policies, there is no ratio of how many advanced PT with advanced experiences you need to have in your working environment. So whether or not it requires more advanced clinicians in the higher level university hospital, or you may, so the manpower arrangement is, there is no difference between to recognize the specialization. And so that's the lack of incentives and or rewards for specialization. And the third thing is, unlike Indonesia, because Johanna just said that they have like 28 point something of the population is children. In Taiwan, a big crisis is our low birth rate, because we have very low birth rate that result in a smaller population of children. And so we have a smaller professional market for pediatric physical therapy. So in, for example, we have like 8,000 something registered PT in Taiwan, but in our association, because it's not required to join the association to practice, so the association has only a little bit more than 1,000 physical therapists. But among the 1,000, the pediatric physical therapists are the minority. So we have a very small group of pediatric physical therapy, but to develop specialization, it costs a lot of manpower and cost. So that will be, we may not have many people interested in the specialization certification. So that will be one challenge that we face. So I think that's my presentation. So I think pediatric physical therapy specialization in Taiwan, I think that's the way that we want to go, but it's still a long way, because we still need to discuss what kind of specialization that we want to have and how do we get there. So I think that's, but I think, in addition to me, I think we have few colleagues from Taiwan also joined the webinar. We have heard a lot and learned a lot from other countries, but we'll bring it back and discuss among ourselves, and maybe I'm consulting some of you and to find the best way for Taiwan. That's my presentation today. Thank you.
Thank you very much, Lee Chow. Do you have any questions that popped up, Carissa?
I do not, but please, anyone, if you, thank you again for attending, and please stay on too. If you have any questions, please put them in the chat as we wrap up. But I want to make sure that we also want to let everyone know that we're hoping to do a screen shot. So if you don't mind staying till the end, that would be great. Go ahead, Barb.
Just one comment for everyone that's on the webinar. We will be having a networking session at the meeting in Tokyo at the end of May. It's on Friday morning. I think it's Friday morning. No, Thursday morning. Thursday morning at 9. We have networking for the IOPTP. And one of the tables for discussion is focusing on specialization, because we thought that that would be a time when those of you who might be coming to the WPT meeting could further discuss some of the things that you've heard today, because hopefully we've stimulated a lot of thoughts in those of you who have specialization, that are thinking about specialization, or those that, that's not in your future. So we want to continue the discussion in Tokyo on Thursday morning at the networking session. So.
Excellent. So if there are no other questions, oh, Mari, she says she's sorry she won't be in Tokyo. I wonder if the IOPTP could act as a facilitator to share some documents, protocols, etc., regarding the process of specialization. In my country, which is Spain, we are about to start the meetings. We would be very grateful if you could share some written information. Does anyone want to speak to that?
I know as from the Education Committee, we don't have any completed fact sheets or policy statements regarding specialization. I don't know if that's something that the IOPTP at this point would have as a priority because it's not all of our members. But I think, especially based on today and everybody's discussion and really the robust participation, we had many more people participate than we anticipated. I think it shows that there's interest in specialization. And Barbara can correct me if I'm wrong, but I certainly think we can act as a resource for countries developing specialization like Spain, and can provide people who might be available for mentorship or might be able to share experiences in their country. So I think at this point, that's the only finalized, approved kind of mechanism we have, is we could try to make connections globally. Barb, do you have any way to expand?
And certainly I would say what we are doing is getting all of the information, and now the education committee can move forward with what is our next step of how we facilitate. And Karen, I don't know if you're still on or not, but certainly for the executive committee for the IOPTP, based on the membership survey that was done, we see that we're being asked to provide information and resources to those of you who are developing specialization. But even I'm thinking for people who have specialization, you may think there's some great ideas that came out today that maybe that's incorporated even with those that have had specialization for a long time. Karen, there you are. So I'll let you speak.
Absolutely, Barb. I fully support that in collecting it, and you will note in the chat I did put a couple of a bit of information related to the networking session that we're having, but also related to a Padlet, recognizing that not everyone will be able to be in Tokyo as much as we would all love to come and visit you, Masako. But there is the topics that we'll be discussing, including specialization, will be there. And one of the questions that I did have in the Padlet was, did anybody have any resources and any links to those resources to hopefully begin to accumulate those? The other piece that we've also done in the background as the executive, as you've noted with a lot of the presentations this morning, is that, typically we don't venture out into specialization on our own, and there's an overview with regards to either the association or some other trend or organization that is looking at it more broadly within the profession. And so similarly, the specialty group presidents meet on a quarterly basis. So that would mean those in geriatrics, those in sports, those in manual therapy and orthopedics, cardiorespiratory, etc. From the World Physiotherapy. And some of these groups, and I'll do the call out to manual therapy and orthopedics as well as sports, have been working on sort of what does this look like internationally. And so sports is about to put out what some of their recommendations are from a international perspective. So I'm hoping again at World Congress to get an opportunity to sit down with the chair of that group to see sort of where did this align and how and what does that look like for them. So hopefully we can also share what some of those other specialty groups are doing, because of course it will impact potentially in many of your countries how you proceed. So just wanted to add that little bit.
Thank you, Karen. Yeah, so that kind of answered Li Chao question that do all specialties such as sports, neurologic have similar processes or requirements for specialization certification? And is it required to have clinical experience in a variety of populations? So if there are any other panelists or speakers that want to speak to that, let us know. But
the only thing I wanted to add, Li Chao, one of your thoughts was related to exams. I think the written exam is a pretty universal requirement, that you can look at the breadth of your practice scope and include things on examination, intervention, and in pediatrics, and everything from infants to adolescent orthopedic injuries. And so that's a given. the practical exam, as Barbara noted, was not really recommended years ago by our psychometrician. It might be worth looking at, if you're considering it, what psychometricians today and 2025 are recommending, but it also is very labor intensive, and you have the problem of how to eliminate bias. Now, in some specialties like orthopedics, it may be more important to have some sort of a practical exam, because your practice base includes a lot of manual techniques. In pediatrics, I'm not sure how we could say there could be one practical exam that would show your expertise in something required of all pediatric therapists. So my thought is, even if within your country, some groups have a practical exam and they can justify why, and other groups do not have it, I think it's appropriate for you to pursue what best fits your practice requirements within your specialty.
Thank you.
So it looks like we have no other questions.
We are fast approaching, within 5 minutes, our 3 hours. So I'm amazed that this webinar has gone on for 3 hours. I was a little skeptical of the increased time frame, but we have put good use to it.
It
And
seemed to work out really well. So I wanted to take this time as an opportunity, if everyone feels comfortable, any of the attendees, to turn on your videos, and we could all, count down 3, 2, 1, and take a quick photo, a group photo, to show, to capture this moment of our webinar. So for those that are on, I'm going to count down. So 3, 2, hold on 1 second. There we go. 3, 2, 1, and smile. Excellent. I captured it. We're good to go. Oh, there's a few more. Wait. There's a few more that turned on. Can we do that one more time? Sorry. Okay, for those that have all turned on, so I'll count down again. Ready? Smile. 3, 2, 1. Got it. Thank you so much, everyone, for coming.
Thank you.
Yep. The link to the attendance is in the chat. Please don't forget to complete that so that you can receive a certificate of attendance, which will likely be mailed out or emailed sometime by the end of tomorrow, within the next couple days. All right. Reach out with any questions. Thank you again for attending. And thank you to our speakers and our panelists.
the only thing I'd add is, the one thing we will have from IOPTP is this presentation will be on our YouTube channel. So as you go back and you want to see more, or if you're developing things and in 2 months you say, I need to review what they were doing in Taiwan or Indonesia, you will have an access to do that.
Excellent.
Thank you.